A true private practice model is one where you're living off the receipts you get from your patient care, meaning your clinic visits, your post-surgical visits, and the surgeries that you perform. So, in occasionally you may get help from things like call coverage in the hospital, things like medical directorships and stuff like that that a hospital can give you, but those are pretty minimal in the overall scheme of things. Now, the two major advantages of private practice: number one is physician autonomy. For example, if you feel that certain things might help your patient flow or your clinic flow, for example, for me, I found that doing Saturday clinics enabled a lot of patients to come and for families to be there for surgical and post-surgical discussions, which was very helpful. You're able to do that without thinking. In an academic practice or a employed position, a lot of times they won't make that accommodation. Number two, you can treat your staff like your own family. Every corporation says it, but we all know that's not true. Things like health insurance, we offer the person making the least minimum wage versus the person at the top of the salary scale all get the same benefits. Profit share, health insurance, retirement, all that stuff are matched. So there is incentive for people to want to join your practice and stay with you. And the fact is that you can see your practice, your family, and everyone grow along with theirs, which is definitely a good thing. In terms of misconceptions, there's a perception, particularly in academia, that private practice doctors make money just by being busy. The busier you are, the more money you make, and that's what people want. That's really not always the case. In fact, the biggest thing that controls your private practice profitability, number one, is your overhead, and number two is your payer mix. That's true whether you work at the Mayo Clinic or whether you work in a small hospital in the Upper Peninsula of Michigan. And the reality is that if you're able to the reality is the busier you are, you actually end up having to spend more, because the reality is that after a certain point, expenses go up with patient care. For example, if I do 10 cases in a month, it's pretty easy for me to handle that with one office staff, maybe a nurse, and a mid-level provider. If you're doing 50 cases a month, it's almost impossible for 2 or 3 people to handle that. You need multiple staff, and that obviously eats into your profitability. So that's the main differences between a private practice and an employed model.